أعزائي طلبة المرحلة الثانية، السلام عليكم ورحمة الله وبركاته. اليوم محاضرتنا عن موضوع مهم وهو Anatomy of the Thyroid and the Parathyroid Glands، اللي هو تشريح الغدة الدرقية وجار الدرقية. First, the thyroid gland. The thyroid gland is a butterfly-shaped gland، يعني شكلها مثل الفراشة. It consists of right and left lobes connected by a narrow midline isthmus. This is the isthmus that connects the two right and left lobes. This gland is surrounded by a sheath. This sheath مثل ما عرفنا من محاضرات النيك الأولى is derived from the pretracheal layer of deep fascia. راح تكون هذه الجلاند thyroid gland is attached to the larynx and the trachea by this sheath which is called the pretracheal sheath. The sheath ما قلنا attaches the gland to the larynx and the trachea، يعني راح تكون هذه الغدة مرتبطة ارتباط وثيق باللارynx والتراكيا بالpretracheal sheath. This is a transverse section in the neck، يعني مقطع عرضي بالرقبة، وقاعد نشوف انه هذا اللي هو باللون الاخضر هذا هو pretracheal what we call the pretracheal fascia. This is a thickening of deep fascia surrounding the thyroid gland and connecting it to the larynx and the trachea at the midline. The attachment of the pretracheal fascia here هذا اللي هي باللون الأزرق اللي هي قلنا surrounding the thyroid gland to extend from the laryngeal cartilage، هذا هو اللارynx وهذه هي غضاريف الحنجرة. شوف امتداد البريتراكيال fascia from the thyroid cartilage down covering the gland and down until it reach to the thorax، يعني إلى أن تتصل بالثوركس اللي هو بالفايبرس بريكارديوم. هذا هو امتداد أو الاتاتشمنت of the pretracheal fascia. فلذلك راح نشوف أنه إمكانية إذا أكو there is an enlargement of the thyroid gland، إذا صار عندنا تضخم بالغدة الدرقية احتمال تمتد عندنا in this region اللي هي behind the sternum. It is called retrosternal thyroid. Why? Because the attachment of the pretracheal layer is extending to the thorax, to the fibrous pericardium. هسه نجي first item اللي هو loops of the thyroid gland. As we said, it have two loops, right and left loop, connected by the midline isthmus. From this figure we can see that the loop of the thyroid gland are pear-shaped، يعني شكلها كمثري الشكل، two pear-shaped loop have an apex and it have base. So each loop is a pear-shaped. The apex is directed upward as far as the lamina line on the lamina of the thyroid cartilage. These are the lamina of this is the thyroid cartilage، هذا هو الغضروف. This is the thyroid cartilage. It have an oblique line. This oblique line is the landmark for the upper extent of the apex of each lobe of the thyroid gland. The base, this is the base, lies at the level of the fourth or fifth tracheal rings. And the isthmus, that's connecting the right and left lobe, extend across the midline in front of the second, third, and fourth tracheal rings. These are the rings of the trachea. هذه هي حلقات التراكية. This is a lateral view to the thyroid gland, to the neck and the thyroid gland. Here, this is the thyroid gland. This is the left lobe. ويعني راح نشوف هنا الاكستنت انه قاعد نشوف انه الابيكس reach to the oblique line of the thyroid cartilage. Base at the fourth or fifth tracheal ring. وقلنا الاسمس at the midline extend in front of the tracheal ring اللي هي second, third and fourth tracheal ring. نشوف العلاقة الوثيقة in between the thyroid gland, the larynx and the trachea. Another loop that is called the pyramidal loop. This pyramidal loop is projecting from the isthmus, usually from the isthmus, upward, usually to the left, يعني جهة left. So this pyramidal loop project upward from the isthmus, usually to the left of the midline, على جهة left, أقرب إلى جهة left. Fibrous or muscular band, قاعد نشوف هذا pyramidal loop راح يمتد upward. There is and it is connected to the hyoid bone by a fibrous or muscular band. Frequently connect the pyramidal loop to the hyoid bone. This fibrous band مرات تصير عندنا muscular and it is called the levator glanduli thyroidea. levator glanduli thyroidea. إذا كانت هذه الباند بها مصل راح نسميها levator glanduli thyroidea. سنجي إلى موضوع هو relations of the thyroid gland. Why we are studying the relations of the thyroid gland؟ يعني what are the structure nearby the thyroid؟ أهمية هذا الموضوع أنه إذا صار عندنا enlargement of the thyroid gland بحالة اللي نسميها الجويتر، يعني هذا abnormal enlargement، تضخم غير طبيعي، فراح تأثر اعتيادي على الستركتشرز القريبة. فلذلك it is important to know the relations of the thyroid gland. First, the anterolateral relation. anterolateral relation، شوف عندنا هاي مجموعة العضلات راح تكون anterolateral relation to the thyroid gland. أول عضلة هي الستيرنو thyroid, superior belly of omohyoid, sternohyoid muscle, and more superficially is the sternocleidomastoid. إذن هاي مجموعة العضلات اللي هي موجودة anterolaterally تغطي لي الثايرويد جلاند، فلذلك أنه راح تكون العمليات اللي على الثايرويد جلاند يجب أنه أتعامل مع هذه العضلات اللي تغطي لي الثايرويد جلاند anterolaterally. بعد another posterolateral relation, another important structure that lies posterolaterally. هذا اللي هو موجود عندي carotid sheath. هذا أول structure اللي هو carotid sheath. طبعا carotid sheath containing the internal jugular vein laterally common carotid artery medially, and in between we have the vagus nerve. So posterolaterally we have the carotid sheath containing internal jugular vein, common carotid artery, and the vagus nerve in between. All these structures are posterolateral to the thyroid gland. Another posterior relation that is in direct contact with the gland is the superior and inferior parathyroid. هتكون ملتصقة بشكل مباشر على posterior border of each lobe, superior and inferior parathyroid. وعندي موجودة الانستموسيس between the superior and inferior thyroid artery, also related to the posterior border of the two lobes of thyroid gland. What is the medial relation؟ مثل ما قلنا بداية المحاضرة، medial relation إنه يكون thyroid gland is closely related medially to the larynx يعني الحنجرة والتراكية. So the larynx and the trachea. Posteriorly we have the pharynx and esophagus. These are medial relation to the gland or to the lobes of the gland. Larynx and the trachea, pharynx and esophagus. But another muscle here, we can see this muscle, it is called cricothyroid muscle. Cricothyroid muscle also lies medially. هذا الترانسفيرس سكشن أقدر أشوف هنا these are the medial relation to the gland. قاعد أقدر أشوف هنا عندي larynx and trachea. Behind is the pharynx and esophagus, and we have this nerve اللي هو recurrent laryngeal nerve. Recurrent laryngeal nerve in the groove. Although this is the groove in between the esophagus and trachea. صورة أخرى من تبين لي الميديا relation عندي larynx and the trachea, the cricothyroid muscle. Cricothyroid, this muscle extends in between the cricoid cartilage to the thyroid cartilage, caused cricothyroid muscle and its nerve supply. هذا العصب اللي يجهزها اللي هو external laryngeal nerve. External laryngeal nerve. Also it is medial to the loop of the thyroid gland. سنجي للإسمس. الإسمس اللي هو هذا اللي midline part of the gland that connect the two lobes. قلنا anterior الاعتيادي راح يغطيه anterior الاعتيادي راح يغطيه السكن fascia, anterior jugular veins, sternohyoid and sternothyroid muscle. posteriorly موجود عندنا راح يكون ملتصق posteriorly بالتراكيا اللي هي in front of the second, third and fourth rings of the trachea. Now we come to an important subject which is the blood supply of the thyroid gland. يعني تجهيز الدم. مثل ما نعرف أنه thyroid glands have from this picture, from this figure, it have a very rich blood supply. So it is highly vascular organ. First, the arterial supply. We have the arteries have a rich blood supply. So it have superior thyroid artery, inferior thyroid artery, and sometimes we have another artery that's called thyroidea artery. The arteries anastomose profusely with one another over the surface of the gland. First, the superior thyroid artery. Superior thyroid artery, this artery is a branch of the external carotid artery, descend to the upper pole of each lobe, and it's accompanied by this nerve which is the external laryngeal nerve. نشوف أنه الأعصاب تكون قريبة على الشرايين. The inferior thyroid artery, this one is a branch of the thyrocervical trunk. Ascend behind the gland to the level of the cricoid cartilage. Ascend up to the level of the cricoid cartilage, and it will turns medially and downward. Turns medially and downward to reach the posterior border of the gland. وراح يكون اللي nerve اللي هو ويا الانفيريور thyroid هو it is called the recurrent laryngeal nerve. هذا recurrent laryngeal nerve either crosses either in front of or behind the artery, or it may pass between its branches. علاقة وثيقة in between inferior thyroid artery and the recurrent laryngeal nerve. هذا مهم بالعمليات على الثايرويد gland. سنجي للارتري الثالث اللي هو الثايرويديا artery. معناها العميق. ثايرويديا artery. مثل ما نشوف بهذه الصور أنه if it is present may arise either from the brachiocephalic artery or from the arch of the aorta directly. يعني عندنا طالع من هنا من brachiocephalic trunk or artery, or from the arch of the aorta. It ascends in front of the trachea to reach to supply the isthmus. Now we come to the venous drainage. We have three veins: superior thyroid vein to drain into the internal jugular vein, the middle thyroid vein which drain also into the internal jugular vein, and we have the inferior thyroid vein. We have two inferior thyroid vein. The inferior thyroid vein of the two sides will anastomose يعني راح يتحدن with one another as they descend in front of the trachea. وراح يكون they will drain at the end to the left brachiocephalic vein. The inferior thyroid vein will drain into the left brachiocephalic vein. The lymphatic drainage of this gland drain mainly laterally into the deep cervical lymph node. عندي مجموعة lymph node behind the sternocleidomastoid. Lymphatic drainage of the thyroid will drain into the deep cervical lymph nodes and a few lymph nodes that lie nearby to the trachea, it is called paratracheal nodes. Paratracheal nodes. What is the nerve supply? اللي هو sympathetic nerve supply. It have a sympathetic nerve that comes from superior cervical ganglia, middle cervical, and inferior cervical ganglia. From this ganglion, it will give sympathetic nerve that supply the thyroid gland. What are the secretion or what are the thyroid gland hormone? It have two type of hormone or three type of hormone: thyroxine and triiodothyronine. This hormone which will increase the metabolic activity of most cells in the body. إذا راح يعني تزيد من المعدل الأيضي لكل خلايا الجسم. هذا الثايروكسين وترايودوثيرونين. And another type of hormone which is called thyrocalcitonin أو هرمون الكالسيتونين. هذا وظيفته أنه it will lowers the level of blood calcium. راح يخفض لي نسبة الكالسيوم بالدم. Parathyroid glands. Parathyroid glands are ovoid bodies measuring about 6 mm in length, and they are 4 in number. يعني عندنا 4 موجودة من هاي الغدد. Closely related to the posterior. This is the anterior view and this is the posterior view. It is so these glands are closely related to the posterior border of the thyroid gland of the lobes, lying within the facial capsule of the thyroid gland. يعني كلش ملتصقة أو مرتبطة بالthyroid gland. First, the two superior parathyroid gland. Superior parathyroid gland are 2 in number. They are common يعني more constant in position. يعني حيكون موقعها ثابت. More constant in position lies at the level of the middle of the posterior border of the thyroid gland. بينما عندنا inferior parathyroid gland, they usually lie close to the inferior pole of the thyroid gland, inferior pole of the lobes. They may lie within the facial sheath or embedded in the thyroid substance, or it may lie outside the facial sheath. لذلك راح نشوف أنه موقع الانفيريور باراثايرويد راح يشكل لنا في المشكلة. راح يكون في المشكلة يعني راح يكون موقعها مو ثابت. يعني inconstant, not like that of the superior parathyroid. هذه المواقع الاحتمال موجودة نوجد بها inferior parathyroid. Sometimes they are found some distance caudal, يعني more inferior to the thyroid gland, in association with the inferior thyroid veins in the upper mediastinum. يعني راح نلقاها بالثوركس near the thymus. What is the blood supply of the parathyroid? This is the same from the arteries that supply the thyroid. These are the arterial supply is from the superior and inferior thyroid arteries. Superior and inferior thyroid arteries. And the venous drainage is into the superior, middle, and inferior thyroid veins. The same venous drainage like that of the thyroid gland. What are the functions of the parathyroid gland? Chief cell will produce the parathyroid hormone, which stimulates the osteoclastic activity in bones. The chief cell will produce parathyroid hormone, which stimulates the osteoclastic activity in bones. Thus يعني تنشط لنا الخلايا الناقبة للعظم. بالتالي it will mobilize the bone calcium. راح تحرك لنا الكالسيوم من العظام and increasing the calcium level in the blood. تحرك لنا الكالسيوم من العظام وتزيد لنا نسبته بالدم. Parathyroid hormone also it will stimulate the absorption. بنفس الوقت راح يزيد لي امتصاص الكالسيوم dietary calcium من ال small intestine من الأمعاء الدقيقة. And the reabsorption of calcium ويسوي لي reabsorption إعادة امتصاص الكالسيوم in the proximal convoluted tubules النبيبات الكلوية. كل هاي الحالة راح تؤدي لي يعني راح يحركها من العظام ويزيد لها بالدم. يزيد امتصاص الكالسيوم من الأمعاء ويزيد امتصاص الكالسيوم، إعادة امتصاص الكالسيوم من النبيبات الكلوية، وكلها راح بالنتيجة يزيد لي نسبة الكالسيوم بالدم. It also strongly diminish نفس الوقت diminish the reabsorption of phosphate، يقلل امتصاص الفوسفات in the proximal convoluted tubule of the kidney. اعتيادي راح يكون secretion of the parathyroid hormone is controlled by the calcium levels in the blood. يعني الباراثايرويد جلاند راح تتحسس نسبة الكالسيوم بالدم، إن طبقا لنسبة الكالسيوم راح ينفرز الباراثايرويد هرمون. يعني إذا كانت النسبة قليلة اعتيادي راح ينفرز الباراثايرويد هرمون على مود يعدل نسبة الكالسيوم، وإذا كانت مرتفعة اعتيادي راح يقل نسبة الباراثايرويد هرمون حتى يعدل لي نسبة الكالسيوم. And that is all about the thyroid and the parathyroid gland. Thank you.